It is that time of year. Unfortunately, Fox 23 learned that the number of RSV, flu, and COVID cases are going up across the state. You're watching Fox 23 News at 6. I'm Sarah Whitley.
And I'm Rick Marinon. Shay has the night off. New at 6, Fox 23's Amy Hybels is live after speaking with doctors about what we're seeing not just statewide, but right here in Tulsa.
That's right, Rick. This afternoon we spoke with Dr. Dale Bratzler. He is the dean of the Hudson School of Public Health at OU. We wanted to find out what the numbers are showing here in the state of Oklahoma and also here locally. We also stopped by a local physician's office for pointers on how you can try to stay healthy through the holidays.
When you look at the Oklahoma State Health Department's website, they point out that the number of cases of RSV, influenza, and COVID are all going up right now in the state. The number of people being hospitalized and the number of people testing positive for those illnesses are increasing across the entire state.
Dr. Dale Bratzler, dean of the Hudson College of Public Health at OU, says the numbers here in Tulsa County are similar to what they're seeing statewide.
Almost 15%, for instance, of the COVID tests that are being done are coming back positive now in Tulsa County. The number of hospitalizations for COVID in Tulsa County has gone up to about 25 to 35 per week when you look at the last several weeks.
He says RSV cases are on the rise, and we haven't hit the peak of flu season, which is actually in January. Your best defense?
Make sure that you've gotten all of the updated vaccines. For people 16 over, we have a vaccine for RSV now, because remember that more adults die from RSV than kids.
Bratzler also recommends having the updated COVID vaccine, as well as your annual flu shot.
Give me a breath in and out.
Dr. John Schumann is a primary care doctor who treats seniors. He says they're seeing a lot of flu and more RSV now that they're testing for it.
With the pandemic, obviously, we're testing for COVID, we're testing for RSV, we can test for flu. So if you test, you're going to find it.
Dr. Schumann says all of these are endemic viruses.
And all of them can have symptoms that overlap. So, coughing, feeling lousy, achy.
He highly encourages seniors and the immunocompromised to get vaccinated.
You get the shot, in about 2 weeks, your immunity goes up. You generate antibody to it.
Suggestions for those traveling over the holidays and holiday gatherings?
Spend time outdoors if you can. If it's too cold, obviously you can't do that. Good ventilation indoors. You can wear masks. I mean, some people choose not to wear them, don't like wearing them. I notice you're wearing a mask. It's never a bad idea, especially if you're going to travel on airplanes where the air doesn't recirculate as much as it does like in the real world. It's a great idea to wear a mask.
When it comes to preventing respiratory illnesses, Dr. Schumann says hand washing is key. You want to use warm, soapy water and make sure to wash your hands for at least 20 seconds.
Sing happy birthday. We fall away from that because it's hard to do. That hand washing is crucially important.
Now, the state will release updated numbers on Thursday on RSV, influenza, and COVID-19. We will provide a link to the state dashboard. Just go to fox23.com and click on this story. In Tulsa, covering news that matters, I'm Amy Hybels, Fox 23 News.